Concussions. On November 1st, 2010, Sports Illustrated awakened the world to the issue of sports-related concussions. Since that time, daily headlines and newscasts tell of the complications that can arise from repeat mild traumatic brain injury, or MTBI, as concussions are referred to in the medical world. While the topic of the effects of concussions on current and former professional athletes gain most of the media's attention, the frequency and side effects of premature return-to-play decisions are even more serious in the most vulnerable population, young athletes from 6 to 14 years of age. Traumatic brain injury, TBI, is the leading cause of death and disability for America's youth. According to statistics from the Centers for Disease Control and Prevention, between 1 million and 4 million new brain injuries occur every year in America due to trauma in sports and recreational activities. More than 767,000 American youth visit the emergency room because of traumatic brain injuries each year. More than 80,000 of these kids are hospitalized and more than 11,000 die. Recognizing the importance of the return-to-play decision, especially in youth sports, TBI Diagnostics is proud to join other public and private organizations in supporting the Cactus Foundation and its Conquering Concussions program. Cactus conducts continuing education courses featuring world leaders in sports medicine and concussions, and its banquets have featured Mike Matheny, manager of the St. Louis Cardinals, and Chris Nowinski, founder of the Sports Legacy Institute, as speakers, all benefiting the Boys and Girls Club of Greater Scottsdale. Chris was given the first Conquering Concussions Hero Award at the 2012 banquet for his pioneering work with student athletes. Perhaps the most difficult decisions that must be made by coaches, managers, parents, certified athletic trainers, and the players themselves is when it is safe and prudent to return to play. The commonly accepted method for determining whether an athlete of any age has suffered a concussion during practice or in a game include a physical examination, with special attention to neurological signs and symptoms, computer-based neurocognitive examinations, balance testing, and eye movement evaluations. Up to now, there has not been a comprehensive, objective, and rapid method to assess the fourth piece of the concussion puzzle on the sideline. Eye movement assessments are entering the game. Contemporary eye movement detection devices combine the latest in electronic and computer technology to evaluate the three critical eye movements which have been reported to become abnormal immediately after concussions. First is the Smooth Pursuit test. Smooth Pursuit is a fundamental ocular motor test system which tracks the eye's response to a moving dot in horizontal and vertical directions. The second eye movement is saccades, which measure the patient's eye response to following a dot that moves abruptly right and left horizontally and vertically. The third ocular motor test is optokinetics, which refers to movements of the eyes in response to the movement of objects, such as horizontal and vertical stripes, across the visual field. TBI Diagnostics has enlisted the assistance of the world's foremost experts in recognizing and treating patients with sports-related concussions to investigate the role of eye movements in assessing mild traumatic brain injury and their role in avoiding long-term complications. TBID is currently commencing sponsorships of clinical trials in virtually all major sports and in a wide range of age groups. Our goal is preventing or reducing the frequency of sudden impact and recurrent concussion syndromes, as well as more serious long-term complications such as chronic traumatic encephalopathy, or CTE. For more information regarding how your program can increase its awareness and knowledge of concussion assessment and the return-to-play puzzle, please contact us at info@tbidiagnostics.com or call 480-383-8408.